Ask the Messenger's TV show is a TV show that educates, informs, and entertains our viewers on public health issues such as mental illness, suicide, addiction, illness and disease, COVID-19 relief, crime, domestic violence, homelessness, human trafficking, employment opportunities, healthcare, and more. And now, Ask the Messengers.
The DWIHN Integrated Health Network provides services and support to 75,000 people in Wayne County. DWIHN serves people with mental illness, intellectual and developmental disabilities, individuals with substance use disorders, and children with serious emotional disturbances. DWIHN is the largest and most diverse community mental health agency in the state of Michigan, and it is committed to providing the highest quality of integrated health care to those it serves while working alongside with dedicated and compassionate provider network. Today on Ask the Messengers, we bring you another episode in our DWIHN Integrated Health Network Partnership Series featuring quality behavioral health, or better known as QBH. We have an interview with the Executive Director, Naveed Saeed, Counselor Courtney Pippin, plus we'll give you an inside look into their mobile units. Ask the Messengers begins now. I'm here with Courtney Pippin. She is a QBH counselor, and she has also experienced the services. So first, I want to welcome you to the show, Courtney. Thank you for being here today.
Thank you for having me.
So what do you do as a counselor?
Well, we provide hope to people who come in the door. Many people come in with experiences that are traumatic and they need somebody just to listen to them. So being there to listen and to give them guidance, help them find new tools to help move forward in their recovery.
From your own personal experience, so you have utilized the services in the past. Can you tell us tell us how did you end up needing the help, and what did they do to get you back on your feet?
I struggled with substance abuse for many years, in and out of treatment centers, and I finally came to QBH in 2017. And something there just made me want to put the effort that I was putting into drug use into something more positive. So slowly but surely, I started to get my life together. I had counseling services, I had peer recovery coaching, I had case management services, and all of those things combined really just helped me put my life together and become the person that I am today.
Awesome. So how rewarding, or what is the impact that you feel when you are doing your job as a counselor? And I guess we couldn't even call it a job, as you're doing your ministry as a counselor. How does that, being where they were at, how does that help motivate you as well?
Seeing people that have come as far as I have, and even people that are like in the progress of moving forward, it's just an amazing experience to get to work with these people and to see the change, the positive change, because you don't get to see it every day. So when you do, it's extremely rewarding.
So what do you find right now? Like, what is the greatest need within the community right now?
Awareness and prevention, I would say. We're losing a lot of young people to addiction and a lot of productive people. And it doesn't just impact the person that's using it, also impacts the family and the community indirectly. So awareness and prevention are two of the most important things that we need to focus on right now.
Mm-hmm. So how can we bring about more awareness? Because a lot of times people say, well, the advertisement is here and it's there. What are some of the things that we could do to really help bring that awareness and even break the stigmas, for that matter?
The mobile units will help tremendously, going out into the communities and bringing awareness to the people that don't have access to that sort of treatment. So the mobile units are a huge step forward in advertising.
Awesome. Well, thank you so much for all that you do. And is there anything that you would like to share, some words of encouragement to the viewing audience right now?
Just if you're struggling, please reach out and get help. It's out there, and we are all here for you, especially at QBH. We welcome anybody 24/7. We're here for you.
This is a lobby where people can wait here and sit And the hallway here, we have 2 counseling rooms here. It's all on a bus. Right here, and then this is the area where we do the dosing. This is somebody waiting here, and then this is where they come and we dose, and they have safes here to keep the medications. These all have to be approved. They have been inspected and approved by DEA, where we keep all the medications, and people can come in, and we take these trucks all around the community, mostly in the east side of Detroit, and like I said, in Canton and Inkster, hopefully. This is Mary. She's a recovery coach. She goes around the buses as well. And this is a harm reduction truck. We give out Narcan from here, also in the community. We go out and show how to use the Narcan and things of that nature, you know.
Wow.
Where there's a distribution center where they get Narcan from here.
Wow.
And we have this one. It says mobile intervention.
All on a whole medical. Now that's amazing. An entire medical facility on wheels.
Yeah.
Man, we've come a long way.
Yeah, I agree. And then see, we got all cameras and security features here. And this is again another. They have telephones like we have phones in the office, and this is a dosing area where patients come, and this is a pump for methadone. This has also been inspected and approved by DEA. And this is a dosing window, where people can come and get the medications. So they don't have to line up in the morning around the block waiting to get medicated. We go to them. And this is a group area where they can come here and they can do 2 things. They can wait to be medicated here. And we can also provide group counseling here. This one also has a bathroom. If we have to do the drug testings and something, you know, they have a bathroom here, and waiting, a refrigerator, and television. Really comfortable here.
Stay tuned for more of Ask the Messengers.
All right, welcome to the show, Naveed Syed. He is the Executive Director of Quality Behavioral Health, which is better known as QBH. Can you, first of all, let me welcome you to the show, and thank you so much for taking your time to talk about your services.
Thanks.
So what does QBH really, what do they do?
Well, QBH started in 1995. We help people with addiction disorders and behavioral problems. We provide a variety of services for people who are fighting addiction, and also behavioral issues, mental health issues as well. And sometimes both of them come together. We have been in business, like I said, since 95. We provide substance abuse services mostly in the southeast part of Michigan, primarily within the Macomb and Wayne County. We provide withdrawal management services, which was known as detoxification at one time, and where people who are intoxicated, they come and we do a medical assessment and provide them with medications and support so they can withdraw. And that process between 3 to 5 days. And after that, we transition them down to a residential treatment center, where they spend about a month or so, depending on who they are and what services they need. And when that is completed, they go for outpatient services. And during the residential services, they receive a variety of services, including support and all the tools that they need when they go out in the community or to work, or go back to school, or whatever they have to do in the community to be drug-free. And we provide help with case management as well, helping them with housing, employment, education, and things of that nature. So that's pretty much what we do. And There are a lot of people who need help, but they cannot come. So our access is 24/7. We are the only treatment facility here that takes people around the clock. 3 in the morning, you're welcome. And we have a nurse around the clock who do an assessment, get in touch with the doctor to see what needs to be taken care of. And then we admit. We have collaborations with various emergency rooms in this area. We work with Hope Not Handcuffs and various police departments and correctional facilities where people need help. We provide them. We're there for them right there and then.
Wow. So what makes your services so important? I mean, you guys are 24/7, which is really good. So what is the importance of being able to do that?
Well, the importance is this: we are there when they need them, when they need the services. See, more than 500,000 people in the state of Michigan are the ones who are not getting the services. Out of 10 people, only 2 get the services. So we got 80% of the people who don't have any services. Right now, with the data that we have, there are 638,000 who need services, and then we are only got like about 20 of them receiving services. So there has to be awareness in the community. So what we have everything under one roof. Provide withdrawal management, case management services, transportation, and be there for them whenever they need. We pick them up around the clock, and then also when they are completely done with the treatment, when they are discharged, or if they don't have a home, we have recovery housing as well. And during the recovery housing, we help them with case management services and help them with employment, housing, and education, whatever that they need or that we can provide. And we do outreach services now. We have been doing outreach services through the mobile units that we have. We were going out in the community and helping them with various things in terms of substance abuse. But most recently, what we started doing is the Drug Enforcement Authority has relaxed the rules for methadone treatment. Methadone is one of the oldest medication they use under the medication assisted treatment program, and it's very effective medication. And then it's very hard to get in these programs. There are a total of 50 agencies throughout the state of Michigan that provide these services. And with the relaxation of the rules, what we want to do is outreach in the community. So we have some mobile units that we have modified and renovated and gotten them licensed by Lara, and then they have been looked into they've been examined and inspected by the Drug Enforcement Authority, and very, very, very close to starting this outreach services in the city of Detroit, the hard-hit areas, in the east side of Detroit, and also in the city of Canton. And we want to reach out in places like Inkster and other places. There were some methadone clinics that closed, and people have to go and line up for hours to get services. So we want to be right there and then. And the continuum of care is important. They come to us for withdrawal management. They get their help, and we want to help them with transition and then community into the community and help them with outpatient. And if they cannot come to us, we go out to them in the community where they come from. Mm-hmm. So what we do, and that makes us a little different. We are the only treatment center in the Wayne County, and I would say in the Southeast Michigan, that provides detoxification or withdrawal management or residential services that also administers methadone in a residential facility. So that helps people with the assisted treatment. And now with fentanyl on the rise, a lot of people are dying. It's not the heroin that's killing them, it's fentanyl that's killing it.
That's what I was going to ask you. What are you seeing mostly in the community? So fentanyl is really high right now, huh?
It's pretty high. It's been going up for the last 5 years or so, but it's crazy now. It was laced with heroin before, but now they are using fentanyl in various other stimulants. Wow. So you're not, I mean, if you don't do heroin, you do cocaine, you probably will have that in there, or some other pills will have fentanyl in it.
Coming up, more of our DWIHN partnership series featuring QBH. Ask the Messengers. We'll be right back. Is there a fee? Is it a fee base? Is it free? Is it Medicaid? Is it insurance? How does that work?
Above, we are a private nonprofit business. We do have contract with DWIHN and Macomb County for people who have no insurance and for people who have Medicaid or Healthy Michigan. Okay, and there are people who do not have any insurance. We work with them. Like I said, we're not here to make a profit, and we help people if they come from out of town and they have nowhere to go. Yes, we provide free services, or we work on a plan on sliding scale, or based on what they have an ability to pay.
Okay. So how would someone contact you to utilize your services? How do they find you?
They can call us anytime. We have a call center that takes calls around the clock.
Okay.
And they coordinate transportation or tell them if someone is bringing them to us.
Okay, awesome. And that information is right there on the screen. All the website, the phone numbers, the call center that he just spoke of, it's right there on the screen. Just call whenever you need some help. What motivated QBH to even get started? How did it even come about?
Well, I was interested in substance abuse because I have a master's degree in social work. I was a counselor, and I was working in a mental health facility. And what I saw in my practice, a lot more and more people were coming with addiction. They had a lot of drug addictions of different kinds, along with mental health.
Okay.
So I decided to start something, and I started as a private practice, and then it grew. And the need at that time, when we started in '95, there was no opioid epidemic like we have today. But like most people were abusing crack and alcohol, and heroin was there, but the insurgent came later on after we started the programs. And with the need, we grew. We grew quite a bit. Now we have 6 locations.
Mm-hmm. That's really good. So you know what? I really appreciate everything that you do, and I'm glad that you provide the services 24/7, because that's really important. Because a lot of times when people need care and need treatment or need help, they go to the emergency room, but the emergency room is not going to treat them in the way that you're going to treat them.
Yeah, they intervene and they save the life. I mean, it's a start. Once somebody has an overdose, they go and check and make sure everything is all right. If they're fit for rehab or detoxification or withdrawal management, that's the starting point. And then once we come in place right there and then, it's a good start. If they are serious about the recovery, if they want help, they will hear them.
Okay. So basically you get that. That's the other question I was going to ask you. So when you get someone that comes in and you give them the treatment that they need at that moment, what happens if they do need the long-term care or need to go into another care? How do you handle, what's the process basically?
Well, when they come in here, when we do an assessment, and based on most people need withdrawal management because they need to manage all the withdrawal symptoms that they get. Once that is done, those are the physiological symptoms. When they are gone, then they have to deal with the mental issues, the psychological issues. And people have a variety of other problems. They might have mental health issues, depression, anxiety, and other kind of problems which need to be addressed, and variety of other social services need. They might be homeless, they might have an issue in the family, marital problems, occupational problems with the boss, and financial issues. We make a comprehensive treatment plan, and after that, we work with them on each or every issue that they have. And whatever that we can do during that period of time, we address that. And when we transition them to the community or for outpatient services, we might refer them. We usually refer them to other specialties, like they might need a psychiatrist, they might need a vocational counselor, they might need a doctor or a dentist or somebody else. So we link and coordinate the care.
Awesome. So if you had any final words that you would like to share, some words of encouragement, what would you like to say to the viewers that's listening right now?
I would tell everyone here, if you know someone who's struggling and who has a drug and alcohol problem, a young person, they might not talk about it. Like I said, 80% of the people don't get help.
Mhm.
Call us right away around the clock. You know, our number is 1-855-838-4222. Or let me do it again, 855-838-4222. And call us around the clock, or locally you can be reached at 313-922-2222. This is the easiest number. Call us and we'll be there for you.
Awesome. Well, thank you again for everything that you do, and much continued success. And I really hope that our younger generation will find another way to handle their issues and not go to drugs that are basically taking their young lives. They haven't even got started yet. So
All right.
let's hope for a better day, right?
Absolutely.
Well, that concludes this week's episode of Ask the Messengers. We also invite you to follow us on Facebook, Instagram, Twitter, and to subscribe to our YouTube channel. If you would like to help support our show, please feel free to make a donation of any kind by visiting our show website, www.askthemessengers.org. If you prefer to mail donations, please make check or money order payable to Ask the Messengers TV show and send it to 18400 Schaefer Highway, Detroit, Michigan 48235. Ask the Messengers is the program that deals with things that help you. Thank you for watching.